the evidence is pretty much overwhelming. This is a remarkable therapy, and that it can be used in high dose very safely. This is like 13 years now. I've been using it in very high doses with virtually every patient that walks in my office. If they have cancer, I'm going to give them much higher doses, but pretty darn high doses. And all I can say is it's really remarkable on how well that has ramped up my ability to help people with cancer. Melatonin doesn't act like a hormone because there's no negative feedback inhibition. You can give it in massive doses, massive, huge doses, way more than you'd ever think. By the way, the safety on it is incredible. You can use doses that are way beyond physiological level for years and years and absolutely no problems. But you will hear people say that. Don't take too high a dose of melatonin because then you'll become addicted to it and you won't be able to stop it. That is not true at all.
You inspire me to be the higher me. You're my inspiration to create.
שלום לכולם וברוכים הבאים לפודקאסט השראה להבראה. Welcome to my podcast, Inspire to be Higher.
Deep within, let your dreams begin.
Hello everyone and welcome to Inspire to be Higher. Today we have Dr. Frank Shallenberger. He's been practicing medicine for an impressive 50 years. He's a true pioneer in the field of ozone therapy and regenerative medicine. And he's responsible for introducing ozone therapy from Europe to the United States, where he's been teaching it for about 25 years. Dr. Shallenberger is also a developer of ozone therapy, a highly effective approach that has gained widespread popularity around the world. In addition to his clinical work, he's the editor of the Second Opinion Medical newsletter and the author of two influential books, The Type 2 Diabetes Breakthrough and Busting with Energy, both now in their fourth printing. We're incredibly fortunate to have him as our guest, and I want to thank him for joining us on the podcast. So thank you very much for joining us.
Well, it's certainly good to be with you. I look forward to our conversation.
Great. So we're going to dive into the fascinating subject that has profound implications for health and wellness, high-dose melatonin therapy. Dr. Shallenberger will shed light on the science behind melatonin, its uses beyond sleep, and how this powerful antioxidant might benefit us in ways we're only beginning to understand.
Yeah, so the backstory is that a writer published a book. Russell Ryder, first of all, for the audience, is a researcher at the University of Texas in Austin. And so he published a book in the late 90s, and I read it, and it was a little incredulous to me because I'd always thought, like I think most people think of melatonin as being a sleep aid, and that's it.
Yeah. That
it's just made in the brain, it's just a sleep aid, and well, anyhow, we'll get into that a little bit. That's not quite true, but but what really changed my mind was I invited him to speak at one of our conferences back about maybe like 12 years ago, and he shows up. At that point, I think he was like 83 years old, and he was as sharp and as bright and as energetic as anybody you'd ever meet.
Wow.
And just brilliant. And for about an hour and a half, he laid it out to us, all these facts that we can talk about today that to me were just surprising. And so based upon that, I started researching it myself. And sure enough, the evidence is pretty much overwhelming that this is a remarkable therapy and that it can be used in high dose very safely. So we can get into that a little bit more. But right after then, so this is like 13 years now. I've been using it in very high doses with virtually every patient that walks in my office. If they have cancer, I'm going to give them much higher doses, but pretty darn high doses. And all I can say is It's really remarkable on how well that has ramped up my ability to help people with cancer.
Is it true he has over 1,000 or more papers on the subject?
He's an astounding guy. He's that guy that you want to be like. Just amazing. And his name is on at least 4,000 papers. When you stop and think about it, 4,000 papers. That's pretty incredible. His whole life has been focused simply on melatonin. And for 50 years, he's been like, bang, he's just looking at melatonin. And so I don't, and then from his group,
Yeah.
he's taught all these other people, they've spread out,
Yes.
and they're publishing articles all over the place.
Yeah.
And many of them, which his name is on them. I want to tell the audience a little bit about melatonin itself.
Yes.
These are things I'm going to bring up that I think most people are not aware of and yet are very important. So first thing is that although melatonin is described as a hormone, meaning it takes a message from one thing to another, it doesn't really act like a hormone. And one of the ways it doesn't act like a hormone is our bodies produce it. And with hormones, if you take an excessive amount of the hormone, it'll stop your body from producing it. It inhibits the production of your own. So at some point, if you were to stop the hormone, you don't have any hormone left. So you kind of get addicted to the thing. So you got to be very careful about giving hormones in high doses. Melatonin doesn't act like a hormone because there's no negative feedback inhibition. You can give it in massive doses, massive, huge doses, way more than you'd ever think. By the way, the safety on it is incredible. You can use doses that are way beyond physiological level for years and years and absolutely no problems. But one of the things, it doesn't give you negative feedback inhibition. But you will hear people say that. Don't take too high a dose of melatonin because then you'll become addicted to it and you won't be able to stop it. That is not true at all.
Right.
I can tell you that. The other thing is that after you take it orally, the levels in your blood peak out after about 1 hour. And then they start to go down, but they do stay elevated for about 4 hours. So when we're dosing it for patients with cancer, we typically like to give it like every 6 hours, maybe 4 times a day, right through the clock. Now, the other thing I want the audience to know is that melatonin is produced throughout the day. We all our focus on melatonin, at least mine has been, and I think many people, is that we focus on the melatonin produced in the brain. What we don't understand is that melatonin is produced in virtually every cell in the body, not just the brain, and especially the gastrointestinal cells. They produce a huge amount of melatonin. So when you look at research on the brain, you find out that the amount of melatonin produced in a 24-hour period is, for example, in the order of 0.5 milligram, 1/2 of a milligram. But when you look at the amount of melatonin that's produced in the entire body over 24 hours, it's 400 to 500 milligrams. It's a whole different deal. So you've got the way melatonin works on our brain, and we could talk a little bit about that, but we also have to talk about how melatonin works in every cell in the body. And so I find that in cancer cases, if I'm given a really large dose, and for the audience, I'm talking in the order of maybe 1,000 milligrams per 24 hours, like 250 milligrams 4 times a day spread throughout the day. And then people will say, well, wait a second, melatonin makes you fall asleep, right? I mean, they're going to be sleeping all day. The reality is melatonin does not make people fall asleep. The way this works is the melatonin sensitizes our brain to the effects of light and darkness. So that what makes us fall asleep is darkness. But if we don't have enough melatonin, we're not sensitized to the darkness. The darkness comes, we don't fall asleep. And you'll see that with older folks, for example, that aren't taking melatonin, like say in their 70s or 80s, they're not taking melatonin. It can get dark and they could be wide awake. And it could be light and they could be sleepy. So they tend to lose that sensitivity to the light and dark cycle, which is so critical to health, by the way, as we disrupt that light and dark cycle. And we started doing this back in the 1920s when the light bulb was invented. All of a sudden, you don't have to go to sleep when it's dark. We can turn the light on and stay up all night long. That really fouls things up a lot. So I think it's important in the context of what we're going to talk about when we give melatonin to patients with cancer. I've spent a lot of time telling them, listen, when it gets dark, I want you going to bed. And when it gets light, I want you getting out of bed. And that's part of the therapy with the melatonin, is to keep that circadian rhythm going. That's so important.
Right. Also, maybe the blue light blockers are good for this. The red and the yellow glasses.
Yeah, I'm familiar with the blue light blockers. I don't know. I have to confess, I don't know much about it. I do know that it's probably not a good idea to shine a lot of blue light in your eyes before you're about ready to go to bed.
Right.
There's something about just having that one frequency of light that this disrupts things, but I don't really have a
Disrupt
firm
the
understanding.
melatonin production, right?
Well, any light blocks melatonin production in the brain,
Right.
but not in the rest of the body.
Okay.
So you got to think of them as two different compartments, what melatonin does in the brain and what it does in the whole rest of the body.
And what does it do in the whole body?
Well, specifically, it regulates the immune system. It regulates the uptake of glucose, which I know you're interested in, and we could talk a little bit about that. It upregulates this condition called apoptosis, which is just a fancy word for natural cell death. So what our viewers can understand is that the nature of a cancer cell, the nature of it is it won't die. It just keeps multiplying and it won't die. It doesn't have programmed cell death like healthy cells do. And so what you want to be able to do with a cancer cell is be able to change it to the point that it will have controlled cell death. And that is apoptosis. And melatonin stimulates that. So it helps to do all that. It has a direct anti-cancer effect as well. And all of what it does, I have to say, if you talk to Dr. Reiter, 4 hours later, you'd learn a whole lot more about what it does.
Yeah.
All over the place. From my perspective, I've studied them mostly in the context of treating patients with cancer.
Yeah. I'm also familiar with treating autistic children and adults. Many times they have issues with sleep and with regulating the circadian rhythm. The parents are always asking for it. So it's
And when you I don't really have much experience with autism. When you treat an autistic child, and it's true, I know they have fragmented sleep.
Yeah.
What sort of milligrams do you use?
So it depends. You have to get a prescription. So if they get a prescription from a doctor, it's approximately between 1 and 3 milligrams. It's a very low dose. But some people buy it online themselves, and they can get 10 milligrams. Functional doctors prescribe 10 milligrams for autistic children.
The other thing that I think autistic kids have, you would know more than I probably, but is problems with their gut, problems with the intestine. And the majority of melatonin produced in the body is produced in the intestinal cells.
Right.
So there may be a relationship with that as well.
Yes. Gut-brain axis, it's all connected. So it's always this thing.
I think that Reiter would say that it's the strongest antioxidant in the brain. And the rest of the body, I don't know, glutathione's pretty strong antioxidant.
Okay.
CoQ10's pretty strong antioxidant. And it probably depends on what area of the body and or what area of the cell we're looking at. Because these antioxidants, don't necessarily stay in the same part of the cell. They have actions in different part of the cell.
Right.
But yeah, it's certainly in the brain. Dr. Reiter would tell you it's the strongest antioxidant in the brain,
Okay.
which is one of the reasons why it's so valuable for neurogenic diseases.
So, can you tell us how it inhibits tumor growth or metastasis?
Sure. First of all, it has a direct anti-cancer effect. So if you take cancer cells in a culture dish and you put melatonin in that culture dish, they won't grow.
Wow.
They die. It directly kills cancer cells. Secondly, it regulates the immune system in such a way, and I'm not sure quite how this works, but I do know this much. I've got a lot of experience treating patients with advanced stages of cancer. And the thinking is, well, these people have suppressed immune systems. They, for the most part, don't. In fact, I stopped measuring immune systems function in patients with advanced cancer because their immune systems were all good. There was no point in making their immune systems better. The problem with patients that have these cancers is not their immune systems. It's the fact that the cancer cell is able to shield itself from the immune system. And there's certain cells and chemicals involved in this shielding process. And I believe melatonin deactivates the shield.
That's
But it certainly has an immune-related effect on cancer cells. You can see that in the animal studies.
That's very interesting. It's like
Yeah.
it's like the wall when you have all kinds of pathogens in the body. They're building like a biofilm, like a coating wall that doesn't let the treatment treat. So here we have this kind of thing that the melatonin takes down to enable the immune system to go to and treat, really.
I think that's a lot of what happens in the gut.
Mm.
Is that all the problems that we have in the gut, which are extensive for many, many different kinds of problems, are due to the shielding effect or the biofilm effect, where you got a perfectly good immune system, but it just can't get to the problem.
Right.
Being shielded. And there are going to be things, various things, not just melatonin, which tend to break down that shield.
Right. It
So
reminds
it'll do that. You'll have a direct immune kind of effect. You have a direct cancer effect. It actually kills it right away. And you know, it also, when you use it properly with chemotherapy and or radiation, it dramatically limits the collateral damage from those treatments. So for the audience to understand is, I've been using chemotherapy in a slightly different version than what's conventionally used for at least 15 years. And what I can say is that when you inject a chemotherapy drug into the body, the listeners want to understand that that drug equally goes into all the cells in the body. It doesn't discriminate between healthy cells and cancer cells. It's taken up into every cell in the body. The nature of a chemotherapeutic agent is such that cancer cells can't tolerate it nearly as well as healthy cells. So if you get the dose just right, you'll kill the cancer cell, but you'll only make the healthy cell sick. You won't actually kill it. Melatonin prevents the healthy cell from getting sick. And that's both from radiation and also from chemotherapy. So as an adjunctive treatment to patients getting chemotherapy or radiation, it's absolutely fabulous. That's one of the things that I really appreciated a lot. When I have my advanced cancer patients and I'm giving them in the order of 500 to 1,000 milligrams spread throughout a 24-hour period, and at the same time administering chemotherapy to them, they might have a few minor side effects, but they have nowhere close to the side effects that we see. I could tell you some great stories
Yeah.
I'm thinking of one right now of throat cancer, but they have nowhere near the side effects that these other patients get. And it's such a shame that this so easy, so inexpensive, so absolutely safe substance is not used by oncologists.
It is.
But if you're taking chemotherapy, you could do it on your own. Don't expect the oncologist to do it. Just do it on your own.
Yeah, that's for sure. But how do you explain this? That the establishment doesn't recognize this benefit and
No, that's what we always ask this question, and the answer is not surprisingly, it's money. It's
yeah,
pure and simple. It's money to a certain degree, power and reputation and things like that, but it's all about money. If if Horst Keith is a German that was big researcher in ozone therapy many years ago, and one of his famous quotes is that if ozone were patentable, it'd be in every hospital in the world.
hmm,
It's not patentable, so it's not in every hospital. The
right.
only thing you're going to get in hospitals and with conventional medicine is stuff that's patentable. You're going to get some drug for your cancer that's like 15,000 bucks a month. So that's what you're going to do. You're not going to get melatonin,
Yeah,
which is what? $15 a month.
right, right.
So it's just money.
Okay, right. So you're saying there's no side effects, but I've seen a few times people that are maybe it can disrupt at first, at least their sleep, or
Yeah.
I think maybe it's because of detox that is going on.
Yeah,
I'm not
I'm
sure.
not sure. I'm not sure why that is. So when I say it's safe, I mean the problems that you have with it are just easy problems, and if you stop it or lower the dose, those problems go away. That's what I mean by that. Nothing bad happens, but you're absolutely right. You will see a subset of the people that if they take melatonin at night before they go to bed, it actually disrupts their sleep. They can get a very hyper-regulated dream state with some disturbing dreams sometimes. Or the other thing that can happen is that they wake up in the morning, they feel like they're drugged. And
Right.
I do have some people that even though I want to give them 24 hours a day, somehow their brain, it crosses the blood-brain barrier. Somehow it's too much for their brain. They can't handle it.
Yeah.
I don't think it's a detox, because if it's a detox, it would change over time. I think it's just that people are different, and not everybody can do it without some of these side effects.
So it doesn't change over time, because in my experience, people just when it happens, they stop. So I never know if it's. And I do recall was a researcher, Huxley, British professor, that said that it's one of the most potent binders for aluminum in the brain to
Oh, really?
detox. Yeah,
Okay.
was years ago already, but so I was always thinking that maybe this is why, but I'm not sure.
Yeah, I'm not sure either. It also could be a metabolic, it could be a part of the metabolic byproducts, because when you take it orally, it's going to first bypass through the liver. The liver is going to change it to medroxymelatonin and maybe some other down metabolites. And maybe some of the way the liver's processing it creates metabolites that create symptoms. I'm not sure why that is. I just know that there doesn't seem to be any way around it.
No, okay.
Not that I've been able to find.
Good to know. So you just prescribe it for in the morning, in the
Yeah.
noon. Yeah.
So typically be about a half hour or so before bed when you get up in the morning, and two other times, like maybe before noon and maybe around 3 or 4 in the afternoon. So it's kind of spread equally, keeping in mind it's got about a 4 hour life in your bloodstream.
And what's the dosage for a typical patient?
Ryder did some studies with animals, and he's an animal researcher, by the way. And what he discovered was that the maximum anti-cancer effects happened when they were taking the human equivalents of about 1 milligram per pound. And so in one of my conversations with him, he told me, I asked him, how much melatonin do you take? Because obviously he's he's a healthy guy and his brain is working great. And he says 180 milligrams. He told me 180 milligrams at bedtime. And then he goes on to say, and pretty much I know all the melatonin researchers in the world, and they're not all, there's only a handful of us. We all know each other. And pretty much all of them take doses like that, because they know the research and such. So typically, I think for you and me, and for people that do not have cancer, that want to prevent cancer, because we could expand a lot on the prevention aspects of melatonin.
Right.
That's what really got me into this game.
Yeah.
But for you and me, we could, I take 180 milligrams before I go to bed at night.
Okay.
Because I'm 170 pounds, so I'm going to take 1 milligram per pound of weight. Now I'm sure there's a limit to that. If you're a 250-pound person, maybe you should take 250 milligrams. 120-pound person, maybe 120 milligrams. But that's seems to be the dose that Reiter consistently found when he's working with the animals.
Okay. Yeah. So can you tell us stories from your clinic?
Sure. Oh yeah, I want to tell you that one story. Yes. So I had, we're seeing a lot of these head and neck cancers, what they call squamous cell cancers, of the tonsils, of the tongue, of the back of the throat. Big upsurge since the COVID injections came about. Big upsurge, particularly in that cancer, and I'm not sure why, but there's a big upsurge with that. So I'm seeing an awful lot of that. And the conventional treatment, which is really good at getting rid of the cancer, by the way, is to shoot some radiation in that area, and it will kill the cancer. The problem is the collateral damage. That's the problem. So if you have a squamous cell cancer, you go and see an oncologist, he says, look, I'm going to shoot some radiation in there. That's going to get rid of the cancer. But unfortunately, you may not be able to swallow again. You might lose your teeth. You won't have any saliva. There could be a lot of problems because there's a lot of stuff here, and I'm going to be radiating it all, and you're going to get some collateral damage. And it's such a shame because you see these people go through this suffering, and some of them need a feeding tube for the rest of their life. It's horrible.
Yeah.
100% prevented with melatonin. 100%. Does
How?
not have to happen. Simply by taking melatonin in the doses I was talking about during the whole course of radiation.
Wow.
I have people that have these tumors, and they come to me, and I say, listen, I want you to get radiation. They say, no, I'm not doing that because I know what it will do to me. And I have to explain this to them. I said, listen, you can see my radiation guy here. He's going to radiate you, and you're going to be just fine. You're not going to have a problem, and the tumor's going to be gone. So one of the shames of medicine these days is that you've got two camps, and they don't typically talk to each other. So you got this radiation guy over here who does a great job radiating cells. He does a killer job. And then you got a guy like me over here does a really good job protecting patients against the radiation, but somehow we can't get together.
Yeah. Yeah.
Because, the radiation guy will say, oh, the melatonin will inhibit everything that I do. Only for the healthy cells. That's true.
Yeah.
The healthy cells won't get radiated. The U.S. Army published a study, I think it was back in 99. And they were looking at how to protect their soldiers from ionizing radiation in case they were in a battle situation where there was all this radiation coming around. So they tested all these substances, and what they did was they draw blood from the soldiers, take their white cells, and expose the white cells to various doses of radiation, and find out, well, what dose caused that white cell to start mutating and getting damaged. So they took that dose, and then they repeated the experiment, but this time they gave the soldiers various substances prior and then they did it again. And they're trying to find a substance that they could take such that that dose of radiation that normally wiped out the white cell did not wipe out the white cell. And number one they found was melatonin. It was surprising. They were looking at drugs and all kinds of stuff. Number one was melatonin. Number two was tocotrienol, which is a version of vitamin E. And so these are things that I love to give to my patients when they're undergoing, either radiation or even chemotherapy, because it's the same principle of chemotherapy. It's the collateral damage from it is the problem, not the fact that it doesn't work. That can be a problem too sometimes. But if you had no collateral damage from chemotherapy, it'd be a piece of cake.
Yeah.
So
Yeah.
that's the problem. And that's what we can work in if we can get both worlds to talk to each other.
Yeah, I think maybe also the fact that it is an antioxidant, but there is no contraindication with anything. So that's very powerful.
Yeah, cancer cells are different than healthy cells. Antioxidant therapy helps healthy cells. It doesn't help cancer cells all that much. It helps them a little bit, okay? But mostly it's helping the healthy cells. And when you stop and realize that that's the problem with these treatments, is not the cancer cells, it's the healthy cells.
Yeah.
And anyhow, so we can do that and it can work out pretty fine.
Yeah.
It prevents metastases. That's published. So if you've got let's say you come to see me and you had a breast cancer, and so we take out the breast cancer, and is it going to metastasize? We can pre-treat you with melatonin before they even do the surgery, or even do the biopsy to prevent the metastases.
And do you find that if the patient takes enough, it really prevents like with 100?
I can't prove that, but yeah, there's animal studies published that show that it prevents metastases in their experiments. So there's no, the studies are mostly animal studies on this. There's not a lot of robust human studies on this. So most of the stuff we know is from animal studies, and we have to extrapolate from there. But yeah, so I think it's important just for the listeners to understand this. If you've been diagnosed with the problem, say especially cancer, and the doctor's saying, okay, you're going to need the surgery or you're going to need radiation or whatever, fine, okay? But prepare yourself for that. Don't immediately next Monday go in and get all this stuff. So if you got a breast lump and you got surgery planned, that's good. But for 3 weeks prior to doing that surgery, let's take care of yourself. Take some high doses of melatonin, take some vitamin C, make sure your diet's good, maybe take some other ancillary vitamins so that you feel good, that you're in great shape. And then when you're in good shape, then go do it.
Yeah.
And then you tend to prevent all these side effects and problems that you could get from those procedures.
Yes. I hear that it's melatonin also protects from radiation, in the sense that if a person goes for a CT scan or anything like that, he should prepare himself by taking a high dose before that. So can you elaborate?
When you look at that Army study I mentioned, they actually computed the dose of melatonin that ought to be used. And the dose comes out to, for most of, and we correlated that with the dose of radiation you get from say the average CT. And I know there's not quite an average CT, but if you figure on the dose you're going to get from a CT, which is pretty substantial, it's roughly 300 milligrams taken 2 hours before the CT will obviate its negative effect on you, which is so important for a lot of the cancer patients because they're getting CTs, like every 3 or 4 months.
Yeah.
So you just, before you go in for that CT, 300 milligrams about 2 hours before.
Great.
One thing I do want to mention, because I know that you and I have communicated about Dr. Seyfried and the work that he's doing, and how important that is, which is incredibly important. And I do utilize his concepts a a whole lot in what we do. Um, what a lot of people don't appreciate is that there's certain receptors for glucose. Cancer cells have these receptors. Human cells have these, natural cells have these receptors. They allow glucose into the cell. Cancer cells thrive on glucose. So it'd be really cool if you could block that receptor without killing yourself. Well, you can't do that because your brain needs those receptors too, so you can't do that. However, melatonin activates those receptors. The way melatonin gets into the cancer cell is through the GLUT receptors. They're the same receptors that the cancer cell uses to get sugar. Melatonin uses those receptors. So in a sense, it's a receptor blocker. It will tend to block the uptake of glucose into cancer cells.
Wow. Okay.
Which is very helpful when you're doing the safe read protocol with the glutamine blockers and the ketogenic type of diet.
Okay, so this
So it works.
mechanism is
That's standard for me. People are going to go on a ketogenic type of diet.
Yeah.
We're going to big old doses of melatonin, and then there's some herbs that you can take that tends to block glutamine. And so we do utilize his principles, and to me it works really well. And I could tell you stories, but then the stories all basically have the same theme. Patient is very sick with advanced cancer, goes and gets conventional treatment. The conventional treatment either doesn't work very well, or they're so sick they have to stop, or some complication pops up. That person comes to see me. Okay, so already got a bad patient.
Yeah.
I'm not getting the easy ones necessarily.
Because
Okay. So what I can,
their whole system, their whole what we call terrain was already through the
they're compromised. Either the conventional treatment didn't work, or it was so bad on them they had to quit, or whatever. But that's what I'm getting. Those same people we can take and we can give them chemo in a certain way, and along with all the other ancillary things we're doing, including obviously melatonin. And we can take those same people, and if you came in my IV room and you looked at them and you talked to them, they look like they're about ready to go out and play golf when they're finished. They smiles on their face, they're talking, they're not sick like zombies, which is what you would see in an average chemo ward. The same people that had problems before, given these ancillary therapies, are breezing through it more or less.
Amazing. And they all are on melatonin, high dose melatonin.
Absolutely, 100%.
Beautiful.
If they can't take it because of some of these side effects, we just lower the dose until we find a dose that's acceptable. But most people can take it. It's not that common, I found.
Right. There is some talk now. People are saying that it might be a problematic for testosterone. Have you encountered this? Do you know?
Well, I do know that it modulates estrogen, the effect of estrogen on breast cancer cells. That's been published, which is one of the reasons we love to use it in cases of breast cancer. So I haven't seen any credible information that somehow, so it disrupts things. But heck, for the last 15 years, all I hear about is people warning about how bad melatonin is going to be. Look, folks, it's 20 years later now, and it's still theories. They haven't come up with anything solid. And I'm dosing myself up and everybody I can talk it into with melatonin for 15 years. I haven't seen anybody get sick, no problems. Everybody's just fine. Don't have to put them on testosterone or anything like that any more than I would anyway. So I can't take these complaints about melatonin very seriously unless they come up with something that is really demonstrable that it's got a problem. Nobody's ever done that.
Yeah.
It just doesn't happen. It's all theory. They say theoretically this could do this, this could do this. Well, that's fine for your theory, but perhaps your theory's wrong.
Huberman is the one with the it's a kind of scare tactics. They're just saying,
Yeah,
I'm not sure why, but
yeah. Just
so
controversy. Controversy is always in medicine.
right, right. And how long does it typically take for a patient to feel the benefits of high dose melatonin?
I don't think you feel anything.
No.
No, most of my patients don't feel anything. But that's kind of the point, because they're getting treatments that normally going to make them feel bad, and they don't feel bad. But it's not the kind of thing you're going to feel. I will tell you this much, it will help your sleep. So if you're already sleeping like a baby, that's fine.
Yeah.
But if you're not, especially if you're an older person or like you pointed out, an autistic person, um, it can make you sleep through the night. I know that for sure. Not everybody, but a lot of people, that the melatonin will help them become more sensitized to the darkness of the evening. And as long as they keep their room dark, particularly if they have if they have to get up in the middle of the night for some reason, any night lights that they use ought to be purely red. Red light doesn't seem to negatively affect the way melatonin works, but they should sleep really well.
So
In
yeah,
those
so
instances,
if they have some kind of like I have this kind of so I don't know if you can see it's red.
yeah, I see. Yeah.
So this is good, right? It doesn't disrupt.
Yeah. Doesn't negatively affect melatonin. Blue light will, red light will not.
Yeah. You said before that you give it to all your patients. It doesn't matter. And you don't have only cancer patients, you have all kinds.
Yeah.
So,
So yeah, the patients actually I enjoy the most are the ones that come in with no problems. And they come in and they say, okay, look, I know that I feel like $1,000,000 right now, but that's no guarantee I'm going to feel this way 5 and 10 years from now. So how can you help me in that? And so we go through a whole procedure, especially around mitochondrial function. But one of the things I try to talk them all into doing is taking 1 milligram of melatonin per body pound of weight every night before they go to bed. And what Ryder has shown in his studies with animals, if you do that in animals, they don't get macular degeneration, they don't get osteoporosis, they don't get dementia, they don't get cardiovascular disease, and they don't get any one of the many cancers he's tested, from colon cancer to breast cancer. And basically what they do, they don't get Parkinson's, they don't get neurodegenerative diseases, because you can go out and you can buy mice that are genetically altered to get these diseases. Okay. So that basically the studies have the same sort of format. They'll go out and they'll buy mice that are genetically programmed to, say, get Alzheimer's disease.
yeah.
And they'll divide the mice in two groups. This group, now they're young mice, so they don't have the Alzheimer's disease yet. So they'll give, this group gets the high dose melatonin, this group doesn't. This group gets Alzheimer's as predicted, this doesn't. It's astounding, all the neurodegenerative diseases that probably could be 100% prevented if we just instituted this cheap, easy, completely safe substance in higher doses than what the quote experts say, which are actually physiological. Remember that there's only a tiny amount made in the brain, but in the whole rest of the body, there's huge amounts made.
Right. And now I recall that Doris Liu is someone that I'm following, and she says that if someone is taking high dose melatonin and feels any side effect, it's because it's not clean enough.
That's true.
Yeah.
That could be true, yeah. So you do want to make sure you get the really pure substance. That's very true. Ryder does address that issue. And that's one of the first things I learned from him is that, yeah, you can't always trust what they're selling out there.
Right, right. Maybe it's because it crosses the blood-brain barrier. Maybe it brings with it any toxins that might be on this
Yeah.
So what is the right supplement?
I make my own pills up. So I learned this thing a long time ago. So I have a company that makes pills up specifically for me. I don't remember it right offhand, but we have those in the dispensary. Also, I do believe that there's a company by the name of Pure Bulk,
Yeah.
Pure bulk.com, and they will sell melatonin in just pure bulk melatonin. Years ago, we had that analyzed, and that was good.
Ah,
We did not find any bad stuff in the stuff from Pure Bulk.
okay.
So those you can get the good stuff, but you do have to be picky.
I want to show you.
It's yeah,
Yeah.
that's the good stuff.
Yeah.
Yep,
Okay.
yeah, that's
Scientific
what we
health
use.
solutions.
Yeah,
Great. So we have it here. Yeah, and this way you can, this is 60 and they even make 120 now milligrams. So
yeah. There's all kinds of people they're doing like melatonin suppositories,
right.
which I think could be really, really valuable, especially for people with like a prostate cancer, but rectal cancer, cancers or issues down in that pelvic area.
Right.
So that's another possibility.
Right. I used to study under Dr. Klinghardt, and
Oh,
he
okay.
teaches how to make suppositories and for the autistic children who will not swallow because
Wow.
they're, you know, picky eaters and all of that. So that's a way to bring it in the system.
Yeah, I don't know. You'd think an autistic kid would do better with the pill than, a suppository, but
Yeah. Is there anything else that comes to mind that
well, yeah, I could also, as you said in your introduction, I've been very involved with ozone therapy,
Mhm.
and so I could say, there's a lot of synergism between things, and the three things that I personally see a lot of synergism with is melatonin, ozone, and curcumin. I see a lot of synergism between those three. So they're kind of my big three.
Mhm.
And then I'll do other things in addition to that. But they're sort of my foundation. They really work together. And for those who aren't familiar with ozone, ozone is a oxidative substance. It's pure oxygen. It's not pollution. It's pure oxygen. And that oxygen molecule, the ozone oxygen molecule, needs an electron. It's electron deficient. So when you put it into tissues, it starts grabbing electrons. That's the nature of oxidation. But when it does that, it stimulates. It stimulates things to happen, and it improves the strength of healthy cells, very much like melatonin does.
Mhm.
So for me, if a patient say calls me up, and this happens not infrequently, and the patient will call me up and said, "Oh my goodness, I wasn't feeling good. I went in to see my doctor. He did a blood test. He said, 'Oh, you've got lymphoma.' And so I went and saw the oncologist yesterday, and the oncologist said we need to start chemo immediately." Which is bogus, by the way. That's just bogus. You don't have to start chemo
Yeah.
immediately.
Yeah, immediately.
Rare would be the event where there's some urgency to this. The thing's been going on for a long time. You just happen to find out about it. That's all.
Years, usually years it
Yeah.
takes.
So don't. So I'll tell them over the phone. Listen, don't tell your oncologist that you can't make it. You've got an important wedding to go to or something like that. And you can't start your treatment for like 3 or 4 weeks. And then during that 3 or 4 weeks, let's do this. Let's do the curcumin. Let's do some ozone therapy. Let's do some intravenous vitamin C therapy. I like that a lot. And let's get you started on this high dose curcumin, clean up your diet, get everything ready, prepare yourself for this, and then continue those things straight through what you're getting, and you're going to breeze through this and get the best result. And the oncologist will tell you, "I don't know what you've been doing, lady, but this result you've had is just fabulous. You must have really responded well to my radiation."
Yeah, taking credit, of course.
Yeah, taking credit for what probably was not true. But
Do you mean IV curcumin?
Yeah, well, IV and oral. Yeah.
Okay. And it has to be very good quality. That's also
Of
an
course.
issue with curcumin always, with the absorption, which is usually a problem, right?
It can be, as you know, there's certain companies that, um, have demonstrated that they have pretty good absorption rates. But yeah, that's always an issue.
Yeah. The high dose melatonin therapy, is it something that you see that people are more open to as time goes by, or do you?
Yeah, I mean, there was just a paper, even in the published literature. But that's true. Yeah, people are becoming more and more aware of this as the years go by. Yeah, even in the published literature, what was it? I want to say within the last 12 months, there was a couple of case studies published where they espoused the beneficial aspects of very high dose melatonin. In this case, it was 1,000 milligrams per 24 hours spread out throughout the day. Um, Demonstrating that it worked really well as an adjunctive therapy to chemotherapy in these patients.
Mhm.
And that was just within the last 12 months. And you would not have seen that a couple of few years ago.
No, that's interesting. Do you think that now that there is a new administration, there will be maybe changes in the
Yeah, I definitely do. Yeah, for sure. We'll
okay.
just have to see how it works. But I do know that RFK is committed to this. I've
Yeah,
had personal conversations with him. He's absolutely committed to doing the right thing.
yeah.
He's he's your basic biohacker, if you will. We
That's
used to call him health nuts. Now we call him biohackers, but whatever. He's that guy, and so he believes in it himself, and he walks his talk. And unless the forces are arrayed against him are so huge you can't deal with it. But he's a pretty smart guy, and he knows where all the bodies are buried. He's gonna he's gonna be able to probably do a good job. We'll see.
wow, wow. Yeah,
I'm very hopeful.
that's so encouraging.
Yeah.
And so two things I ask all my guests. One is what inspires you to do what you do,
Hmm.
and the other is what inspiration do you hope to give to others?
Well, okay, so what inspires me? I would have to say God above inspires me. He made me be this guy. I'm from my earliest age, I just was absolutely interested in the truth. I just wanted to know, tell me what the truth is. And then when I was about 13 or 14, I just thought, I really I want to help people that are suffering from health problems. That seems to be my goal. So it's just like he pointed me in this direction. And he uh, so then I go to medical school and and I learn all about how to do drugs and diagnosis and all this stuff, a lot of good stuff. And and then I get out of medical school, and sure enough, he puts me in situations where I realize, oh wow, there's so much more to learn. I guess one of the things that really made a difference to me was uh, as I was in this post medical school situation, thinking there's got to be more to them what they just taught me. I got lucky. I fell into a study group that met once a month in San Francisco, and some of the doctors in that study group were just absolutely brilliant doctors that were interested in these things and knew way more than I did. And one of them was Linus Pauling. And so we would meet once a month, and that's what that all of a sudden, yeah, oh, bingo. They didn't teach me much in medical school. There's this much to know. They taught me this much. It's really good what they taught me, but that there's this much to know. And so that sets me, it's great fun, isn't it? It's great fun to see people get well that couldn't get well before. They come and they see you and they say, I've been sick for 10 years. I had a woman come in the other day. She had a Gardasil vaccine when she was in her early 20s. Ever since then, she's had 30 seizures a day. 30 seizures a day. And during my first interview with her, she would go into a seizure like every 5-10 minutes. Now, it wasn't a grand mal seizure, but there were seizures. After about a year and a half, we got her down to 10 times a day. Well, that's better than 30 times. It's still pretty darn bad. And now she's, after a few more things, she's down to about 1 or 2 or maybe 3 seizures a week.
Wow.
So, I mean, this is beautiful. This makes you feel good. So that's what makes me do this. It just, that's the way I was born. This is what I need to do.
That's the thing, yes, absolutely. And what inspiration do you want to give to others?
Yes, take care of yourselves. Take care of yourselves. God gave you this beautiful body. Some bodies are more beautiful than others. I got that. But whatever you got, you can take care of it. Don't do what they tell you to do. Eat like your great-grandparents ate. Don't be eating all the processed stuff. If it's got an ingredients label or it's in a bag or a can, probably don't eat it. It's not going to be good for you. Get some sleep. I wrote a book called Bursting with Energy. Read my book. I cover all of these things from sunlight to sleep to water to food to exercise, all the basics. Cover the basics. I guess that's the big deal. Don't be looking for one supplement like melatonin or any other supplement to make the big deal for you. Build that house on a good foundation. Get your foundation right, and then if you then add the melatonin in, something like that. So that would be my advice to everybody out there.
Beautiful. Well said. My thoughts exactly. There is very high value here for people. So thank you. Thank you so much.
Well, thanks for having me on, and God bless you and the work that you do. Keep it going. We need people like you putting stuff out there.
Thank you. Thank you very much.
Okay. Okay, bye, Shara.
תודה שהייתם איתנו עד סוף הפרק. אני מקווה שמצאתם השראה בתוכן של היום. אם נהניתם, אני מבקשת שתשתפו את הפרק הזה אפילו רק עם בן אדם אחד. כך נוכל להפיץ יותר תקווה, ריפוי ושינוי חיובי בעולם. למידע נוסף אתם מוזמנים לבקר באתר שלי shiramed.com. תודה, וניפגש בפרק הבא.